Hello everyone. So let me just check, am I audible? Is the screen clear so that we can start the session? So this is the session of the fifth part of the 100 Anatomy MCQ series which I have started. So yes, let me just check, am I audible? Okay. So my dear aspirants, myself Dr. Monalisa, MD Anatomy from Forces Medical College Pune, and I am here to discuss the Anatomy MCQ series, and this is the fifth part of the 100 Anatomy MCQ series. Let's talk about the special class features. When I am talking about the special class feature, it's absolutely free, and the aspirants, those who are interested, they can join for this session, and this will be absolutely beneficial for them. I would also like to tell, yes, welcome dear Amitabh, Behra and Chitranjan Gherwal. So I also want to tell the aspirants about the special class features, that it's an interactive session where the learners and the educators interact. Okay. So, what are the benefits of joining special class? Raise your hands and get your doubts clear right itself when the session is going on. Never ever miss a session. So, once the session is finished, you can also download the PDF notes, and this will be highly beneficial for you. Anytime, anywhere, read from the top educators of Unacademy platform. So, this will be highly beneficial, my dear aspirants. So, yes, my dear aspirants, the students who are joining for the session for the first time, they can use my code ANAT10 and do present live for the session. Now, I want to tell you about the whole timetable. So, today is the two series. So, already we have covered up the 50 MCQs. Today, I will cover up another 25. Still 25 remains. So, I will cover that 25 MCQs on Monday. Okay, is it okay? So, this is Monday evening, I will cover up that MCQs. So, this is how we are going to cover up the entire 100 MCQs. 7 p.m. is the special free session. You can get connected to me there. Now, I would also like to tell you about the NEET PG free test calendar. So, these are the free test calendars, as you can see here. This is the code which can be used by you to enroll. So, till 12th March. So, 12th March, that is today, the free test calendar has been updated. So, you can join this. I would also like to tell you the importance of plus course, in which all 19 subjects are completed in a very systematic way. You can study from India's top educator, you can compete in live tests and quizzes, you can study on the device of your choice and have an access to 25,000 more MCQs. Okay, you can use this code for getting extra 10% discount. I would also like to tell you about Iconic subscription, where all the plus course and the prep ladder can be merged up. So, plus course and prep ladder can be merged up. It's a well structured course where entire course will be completed, full syllabus, both live and the recorded version. Along with it, you get the benefits of the prep ladder. What are the benefits of the prep ladder? Clinical integrated essentials can be assessed, video lecture, dream team of the prep ladder, and the printed notes of the prep ladder. So, congratulations to the toppers of FMGE December session. I am very glad to share their images with you, and I wish them best of luck so that they can target their competitive exam with a very good rank. Now, the batches which is coming up is the Focus FMG 2022 batch starting from the 16th March, Rockstar, good evening dear, NEET PG 22 All India revision batch, and also the Unacademy store. I am very glad to share this information with you. Unacademy store is starting so on 13th of March, Pusa Road, Old Rajendra Nagar. So, this is a very delightful moment to share this information with you. So, you can join there, you can go there, register there and have your doubts cleared, and also you will have the opportunity to meet the favorite educators and the top educators there. I would also like to show you the slide where the comparison of Plus and Iconic has been done, and this will help you to decide which subscription you should take. So, you can use this code and get an extra discount of 10%. So, let's start with the MCQ session, and this will be followed by special class. So, in this special class today, I have targeted many clinical MCQs. These are I will start the fifth session with few of the direct images, image based MCQ and few direct MCQ. This will be followed by special class which will be of clinical MCQs. Okay. So, marked nerve innervates which of the following muscle? The first MCQ, marked nerve innervate which of the following muscle? Yes, dear Amitabh, Behra, Chitranjan, Gherwal, Rockstar, mark the correct answer. So, you have to identify the nerve and you have to tell me which of the following muscle is getting innervation from this marked nerve. Ravi Kumar, Amitabh Behra, risorius. Okay, this is the nerve. The blue color arrow is on the nerve. So I'm talking about this nerve, the most superior one, dear. The most superior one. So Hemal, this is the nerve which I am targeting. I have enlarged it. Okay, now you will get a better idea. Now you give me the answer. So I got an answer from Rockstar, and Rockstar, you are absolutely right. The correct answer will be corrugator superciliary. This is the superior most nerve. Okay, this is the superior most nerve, and we know that we have got 5 branches, as you know. Yes, 7th cranial nerve, absolutely correct. And we know that we have got okay, and we know that we have got the terminal branches. We have got temporal, zygomatic, buccal, marginal, mandibular and cervical. These are the branches. So here you can see here, these are the branches. If I enlarge this, you can clearly appreciate the branches. So these this is the temporal branch of the facial nerve. This will be the zygomatic branch. These are the buccal branches, upper and the lower buccals. These are this is the marginal mandibular, and the last one is the cervical. So what is these are the 5. These are 1, 2, 3, 4 and 5 terminal branches which is emerging out from the anterior border of this parotid gland. Okay, so like that of a branching pattern of duck's feet. So it is called as, this arrangement of nerve going outside is called pex anserine. This arrangement is called as pex anserine. So this is clear to you. So now we are clear that the nerve is temporal branch, and temporal branch is giving, if I talk about temporal branch is giving temporal, zygomatic, buccal, marginal and cervical, is giving innervation to upper part of orbicularis oculi and also give innervation to corrugator superciliary. So that is the correct answer. So we have got corrugator superciliary as the right answer. Let's move on to the next one. Question number 2. Yeah, what is the feature of the muscle highlighted? What is the feature of the muscle being highlighted? Green color muscle is shown to you. So you have to tell me the feature of this muscle, whether this is a cruciate muscle, whether this is a multipinnate muscle, whether this is a spiral muscle, or whether it is a unipinnate muscle. I got an answer from Hemal. What about others? What is the feature of the muscle being highlighted here? Dr. Swapnil is telling C. Okay, most of the aspirants are telling C, and absolutely correct. C is absolutely correct, the spiral. This muscle is pectoralis major, and this muscle is pectoralis major. Okay, and pectoralis major has got a wide area of origin, but it gets twisted around the insertion point, and this twisting of fibers is giving its name that this is a spiral muscle. So this is a spiral muscle. Okay, pectoralis major is a spiral muscle. So we have got various type, as you can see, circular or sphincteric type. Circular or sphincteric type examples are orbicularis, oris and oculi. Multipinnate is the deltoid middle fiber acromial. Bipinnate, we know that lumbrical muscles, which lumbrical muscles? Third and fourth, and that of dorsal interossei rectus femoris muscle. Yes, that means spiral means convergent. Unipinnate is palmar interossei, first and second lumbricals. Parallel muscles are sartorius. Fusiform muscle is biceps. Convergent muscle will be the twisted, that is pectoralis major. Pectoralis major. So we have got pectoralis major. Correct answer is convergent or spiral. Now cruciate, can anybody give me the example of muscles having cruciate muscle fibers? Can anybody give me the muscle? If spiral is not, then convergent. Yes, if the option was, if spiral was not there, yes Chitranjan, convergent, then we can go for convergent. Yes, absolutely right. But here the options are the most appropriate option, which will be the correct answer, is spiral. Yes, you are right. Then we can go for convergent at that point. Yes, Tushar Patel is absolutely right. The example of cruciate is sternocleidomastoid. One more muscle, masseter muscle. Okay. So multipinnate deltoid muscle, we know that is deltoid acromial fiber. Unipinnate is the palmar interossei and lumbricals. Which lumbrical muscles? That is the first and second lumbrical muscle, first and second lumbrical muscle. So done with this. Let's move on to the next one, that is question number 3rd. All of the following is correctly labeled in this diagram except. So all of the following, so if you want I can slightly enlarge this. Yes, all of the following is correctly labeled in this diagram except. So please go through the labeling and see which is the wrong labeling used here. Question number 3rd. Question number 3rd. Mark the correct answer. Tushar, E. Okay. Absolutely correct, all of you. Absolute. Yes, E is the correct answer. This layer, actually this is not the obturator fascia. E will be Colles fascia. E will be Colles fascia. Okay. E will be Colles fascia here. Yes, absolutely correct. So my dear aspirants, let me enlarge this image. When I am enlarging this image, you can clearly see this layer is the superior layer of urogenital diaphragm. Lower down, so this is the superior, this is the superficial fascia of urogenital diaphragm. This is the inferior fascia of urogenital diaphragm. Got it? Okay. So this is the superficial fascia of urogenital diaphragm. This is the inferior fascia of urogenital diaphragm, and lower down you can see we have got Colles fascia, and in between the space of Colles fascia and inferior layer of urogenital we have got the superficial perineal space. So exactly membranous layer of superficial fascia continuous lower down by becoming Colles fascia. So that is the right answer. Now let's move on to the next question number 4th. Marked structure is a guide to which of the following nerve at the level of the wrist? Marked structure is a guide to which of the following structure at the level of the wrist? Okay, please mark the correct answer. Your time starts now. Question number 4th. Question number 4th. So marked structure, this structure, I am talking about this structure. I am talking about this structure. This is the marked structure. This structure is a guide for which of the following structure? So I got an answer from, I am getting mixed answer A and C. I am getting mixed answer A and C. But if I have to mark the right answer would be median nerve. The right answer would be median nerve. So yes, clearly median nerve is the right answer. The marked structure is a guide to which of the following nerve at the level of the wrist. So we will go with median nerve as the right answer. Yeah. Why? What is this structure? This is palmaris longus tendon. Which structure? This is palmaris longus tendon. This is palmaris longus tendon, and which is a degenerating muscle. So here you can see this palmaris longus muscle when it is going towards, when it is reaching towards palmaris longus muscle, when it is reaching towards the wrist, it merges with the palmar aponeurosis. How we are identifying this is palmaris longus muscle? Because it is merging with palmar aponeurosis. So this is palmaris longus muscle. This is palmaris longus muscle, and we know that palmaris longus muscle is passing superficial to flexor retiniculum. It forms a guide for the median nerve. See this diagram. You can see here in case of median nerve block, you can see here median nerve is passing deep to flexor retiniculum, but the two relations, so for the median nerve block, it is important to locate the median nerve, and a guide which is used for it is the palmaris longus tendon. So which is exactly passing very close and superficial to it. This is the palmaris longus tendon which is passing very close to the superficial and close to the median nerve, as you can see here. One more cadaveric image I want to show you. This is the cadaveric image in which you can appreciate this relation. So I would like to highlight here the palmaris longus tendon. This is the palmaris longus tendon, as you can see here, and as in this diagram you can see here, it is diverging and meeting with the palmar aponeurosis. It is diverging, meeting with the palmar aponeurosis. Okay, this is the palmaris longus tendon. This is the palmaris longus tendon. Okay, now see here. This is the palmaris longus tendon. This is the palmaris longus tendon. Got it? Now, Other than that, what you can see, here, it's just deeper aspect to this. I am showing you this nerve, and the nerve which is just crossing deep to it is the nerve which is MN stands here for median nerve. So that is the reason median nerve is the right answer. Now let's move on to the next MCQ. Question number 5th. Okay, question number 5th. Please mark the right answer. All of the following are correctly labeled in the diagram except. All of the following is correctly labeled in the diagram except. All of the following is correctly labeled in the diagram except. Please mark the correct answer. A is genioglossus, B is geniohyoid, C is longitudinal muscle, and D is thyrohyoid. Amitabh Behra is telling D. Tushar Patel is telling D. Yes. So absolutely correct. The correct answer is D. Yes, thyrohyoid is correctly not labeled. All other labelings are absolutely correct. Actually, what is D? Can anybody tell me what is the correct label for D? Which muscle is this? Can anybody tell me which muscle is this? If it is not thyrohyoid, then which muscle is this? Anyone wants to make a guess? Very nicely you can guess it. Why? Because you are seeing the bones also here. You can see the bony processes here. This is the part we can see here also. You can see the part of the bone. So tell me which muscle is this? Tushar Patel with a question mark. Mylohyoid, absolutely right. Yes, mylohyoid is absolutely right answer. Yes, Tushar, you are absolutely right. Geniohyoid, no, that is B, dear. Geniohyoid is B, that is already shown. No, I am asking about D. D, not G. D. I am asking D, not B. Mylohyoid is the right answer. See here. Now this is the diagram, and you can see this fanning out muscle which you are seeing, which is the largest muscle, extrinsic muscle for the tongue, which you are seeing here. This is the genioglossus muscle. Just below genioglossus muscle, you can see here the geniohyoid muscle. Just below genioglossus muscle, you can see the geniohyoid muscle, and below geniohyoid muscle, you can see the mylohyoid muscle. Okay, so you can see here genioglossus, geniohyoid, and this muscle which I was asking was the mylohyoid muscle. This is the mylohyoid muscle. This is geniohyoid, and this fanning out muscle is the genioglossus. Now also in this diagram you can see the intrinsic muscle, that is transversus muscle, and the longitudinal muscle. So let's move on to the next. Which ligament prevent? Which of the following ligament prevent hyperextension of hip joint during standing? Which of the following ligament is preventing hyperextension of hip joint during standing? The ligaments are iliofemoral, ischiofemoral, pubofemoral, ligament of head of femur, or transverse acetabular ligament. Which is preventing hyperextension while standing. It is a very strong ligament of our body, and many of the aspirants has given the right answer, iliofemoral. Iliofemoral, what is the other name of iliofemoral ligament? What is the other name of iliofemoral ligament? It is also called as bigloi ligament. Bigloi ligament, the strongest ligament of our body, which is preventing the person from falling back and preventing hyperextension when one is standing. It is Y shaped. So see here, fibrous capsule of the hip joint. Yes, absolutely right, Tushar, Praveen Kumar, absolutely right. Now fibrous capsule is reinforced anteriorly by forming a strong ligament. This strong ligament is Y shaped, called as iliofemoral ligament. Yes, Anjana, it is also called as ligament of bigloi, and its attachment is from anterior inferior iliac spine to the intertrochanteric crest of the femur downwards. So it is forming connection between anterior inferior iliac spine, antero-inferior iliac spine to that of intertrochanteric line of femur. Now it is preventing hyperextension of hip when the person is standing erect, and it is preventing the person from falling backward. It is preventing the person from falling backward. Now question number 7th. synovial protrusion beyond the free margin of fibrous capsule onto the posterior aspect of femoral neck forms a bursa for which of the following tendons? 5 options are piriformis, obturator, externus, internus, gemellus superior, gemellus inferior and quadratus femoris. Mark the correct answer. The key word is synovial protrusion is beyond the free margin, and going towards the posterior aspect of femoral neck. So Manish is telling superior gemelli. What about others? So the hint is protrusion is occurring beyond the fibrous capsule and related to posterior aspect of femoral neck. Okay, so that is the hint provided. Beyond free margin of fibrous capsule onto the posterior aspect of the neck of the femur. Which is the right answer? Accordingly, which is the right answer here? Question number 7th. A with a question mark, C with a question mark, C with a question mark. Who gave C as the answer? Praveen Kumar, absolutely correct. Absolutely correct. The correct answer is obturator externus. Okay, the location of posterior aspect. The location is protrusion beyond the free margin of fibrous capsule and related to the posterior aspect of femoral neck. The correct answer will be obturator externus. See here. Synovial protrusion occurring beyond free margin of fibrous capsule onto the posterior aspect of femoral neck is related to which bursa? It is related to obturator externus muscle tendon. So my dear aspirants, I would like to show you the bursa and I would also like to show you the obturator externus bursa and the tendon so that you can approach to the right answer. So see this diagram, let me enlarge it. You can see here the outline of the ischiofemoral ligament has been given. This is the posterior ligament merging with the posterior aspect of the hip joint, and here you can see a protrusion has been seen. Can you see this protrusion? This is the synovial bursa which is protruding. This is the synovial bursa which is protruding, as you can see here. This is the protrusion which you are seeing. This is the synovial bursa protruding, and if you will see close to it, the tendon which is lying very close to this structure, and this is the course of obturator externus muscle. So this is the related to which muscle on the posterior aspect of the neck? That is the obturator externus muscle. That is obturator externus muscle. By the diagram you can appreciate. Okay. Okay, Ravi Kumar, you just correlate it with the diagram. Now you can see here, this is exactly the posterior aspect of the ischiofemoral bursa, and just beyond this fibrous capsule, as you can see in this diagram, the bursa which is protruding is the synovial protrusion, and close to the closest tendon which is lying here. Okay, so here the psoas major tendons has not been mentioned, and the closest obturator externus tendon you can see here. The closest tendon which is lying, this is the obturator internus bursa. The other bursa which you are seeing is the obturator internus bursa which is shown here. But if we will see the margin of posterior aspect of the neck, this is the neck region posteriorly, and the most closest bursa is related to obturator externus muscle, which I have highlighted here. Absolutely correct, Tushar, absolutely correct. Now I would also like to show you this diagram where the location of other important bursas can be appreciated. So you can see here the trochanteric bursa. In this diagram you can appreciate the trochanteric bursa. So here you can see this is the trochanteric bursa, and trochanteric bursa is exactly located between the greater trochanter and the gluteus maximus muscle. Exactly, these are all important for MCQ. It is exactly located between greater trochanter and gluteus maximus. Gluteofemoral bursa is between the iliotibial band and vastus lateralis. Trochanteric is between greater trochanter and gluteus maximus. Gluteofemoral is between iliotibial band and that of vastus lateralis. Ischial bursa is between gluteus maximus and ischial tuberosity. So please all of you note down, these are very important for MCQs. The bursa is related to the hip joint and location. Ischial bursa between ischial tuberosity and gluteus maximus. Gluteofemoral bursa is between vastus lateralis and IT band, that is iliotibial band. Trochanteric bursa is between greater trochanter and gluteus maximus. Now question number 8th. All statement considering ligament of head of femur is correct except. All statement about ligament of head of femur is correct except. All statement about ligament of head of femur is correct except. Options are, it's a weak ligament, it is of little importance in strengthening the hip joint, it contains a small nerve and usually it contains a small artery traversing along with it, it's wide and attaches to the margins of acetabular notch and that of transverse ligament. So Ravi Kumar is telling D usually contains a small artery. Okay, so my dear aspirants, all of you please read the Amitabh Behra is also telling D. All statement about ligament of head of femur is correct except. So please read the MCQ nicely. All statement about head of femur is correct except. You have to choose the wrong one, dear. You have to choose the wrong one. Yes, so Tushar has got the right answer. Only Tushar has given the right answer. So all of you are giving me the you have to mark the wrong statement here. Okay, so absolutely it contains a small artery, that is ligament of head of femur is having ligament of head of femur as a artery, foveolar artery, that is a branch from obturator artery. So we have to choose the wrong one. So it is containing a small nerve is absolutely correct. Actually it is containing small artery, it is a weak ligament. Why? Because it is not giving any kind of stability, but it is very little important in stability and it is attaching to the acetabular notch and that of transverse ligament. All the following statement is correct except the C option. Now ligament of head of femur is a weak ligament because it is not giving any kind of structural or any kind of stability. It is of very little importance when the strength is considered about the hip joint. Its wide end is attached to the margins of acetabular notch and that of transverse acetabular ligament and its upper narrow end is connected to head of femur. Usually the ligament contains a small artery to head of femur. What is it called as? Ligament to head of femur, which is also called as foveolar artery. It is also called as foveolar artery. So absolutely this is the correct important points. Let's move on to the next question number 9. Which is true statement about the carpus? What do you mean by the carpus? Means carpal bone. So please read all. I will provide you with the 30 seconds. Which of the following is the true statement about the carpal bone? Which of the following statement is absolutely correct about the carpal bone? Question number 9. Amitabh Behra is telling D. Ravi is telling B. So yes, I got an answer from Amitabh Behra. No, D. Okay. So okay, great. Tushar has given the right answer. And the correct answer is triquetrum articulates proximally by the articular disc. Yes, so absolutely correct answer is C. Scaphoid articulates with ulna is absolutely wrong. Scaphoid is articulating with not ulna, with the radius bone. Okay, so that is wrong. Lunate is articulating with the ulna bone is it is also lunate and scaphoid both are articulating with radius. Okay. Triquetrum, yes, Hanif and Anjana, everyone absolutely. Triquetrum articulates with the articular disc of radioulnar joint. So absolutely correct. C is absolutely correct answer. And pisiform rides on the palmar aspect of trapezium. That is wrong. Pisiform is lying over the palmar aspect of which bone? Any idea? Pisiform is sitting over which carpal bone? The third carpal bone of the proximal row. What is its name? Triquetrum. Triquetrum. It is sitting over triquetrum. Triquetral, not trapezium. Triquetrum will be the right answer. Pisiform is sitting over the palmar aspect of triquetrum. So now I would like to show you this diagram where you can see the outline of the muscles. So this is the scaphoid bone and this is the lunate bone. Okay, these two bones are articulating with which bone? As you can clearly see, these two are articulating with the radius bone. Now if you will see, this is the bone over which the pisiform is sitting, and the pisiform is sitting over triquetrum. What I told you, it is sitting with the third bone of the proximal row. Pisiform is sitting over triquetral. So C looks too pretty, try to catch her. This is the proximal row. C looks too pretty, try to catch her. Now what about the distal row? If I talk about the distal row, the first in this row is trapezium, trapezoid. The largest carpal bone is the capitate, and then we have got the hamate bone. Okay, so these are all the carpal bones which has been shown to you. Okay. So yes, absolutely correct. So very nicely we can appreciate. Other important point is, if you will see the triquetrum, it is related with the ulnar bone and it is separated from the ulnar bone proximally. Yes, Tushar, on Tushar Patel, on dorsal surface. Yes. No, triquetrum articulate proximally with, means C option is absolutely correct, because it is separated from the distal radio-ulnar joint by the separated from the distal radio-ulnar joint by inferior articular disc. Here will be the location of inferior articular disc. Here will be the location of inferior articular disc. Yes, you can, yes, absolutely right. It will be dorsally, the pisiform will sitting over dorsally. Yes. Yes, let's move on to the next. Okay, before that, I would also like, what I was telling, this is the image which I have taken. This is the articular disc of inferior radio-ulnar joint, and you can clearly see. Yes, I got your point, Tushar. I got your point. It is sitting over. Yeah. So yes, dorsal, when we are seeing this carpal bones, okay. So yes, on the dorsal aspect of triquetrum. So sitting on the, when you will see on the palmar, see here, when we are seeing the carpal bones like this, so pisiform is sitting over, means pisiform is resting over the triquetrum. So the dorsal aspect of pisiform is resting over the palmar aspect of triquetrum. So yes, Tushar, pisiform is on dorsal surface. Pisiform dorsal surface. Pisiform dorsal surface is resting over triquetrum. This will be the perfect right answer. Okay, got it, dear? Pisiform, when Tushar Patel, is it okay? Have you understood my point? Means the dorsal aspect of pisiform is lying in connection with the triquetrum bone. Pisiform location, if I talk about, it is resting over. It is a proximal row and it is lying in the tendon of flexor carpi ulnaris, and it is resting over. When I am talking about pisiform, it is resting over triquetral bone from the palmar aspect. So please write down pisiform bone resting over palmar aspect of triquetrum. Okay. So is it clear, Tushar? Please let me know. Is your doubt clear? Tushar, okay, got it? Okay. So dorsal aspect of the pisiform resting over palmar aspect of triquetrum. Here the word proximal. Triquetrum articulate proximal with the radial. Proximal means towards the elbow joint or towards the shoulder joint. So you can see here again you have got the scaphoid, the lunate and triquetrum. So this is separated from the articular disc of distal radio-ulnar joint. So this is the reason this will be the correct option. Got it? Yes, Tushar. Okay, great. Yes, I can understand sometimes that language makes the thing get in the other way. Yeah. All are contents of suboccipital triangle except. All of the following are contents of suboccipital triangle except. Question number 10th. All are contents of suboccipital triangle except 4 options are there. Third part of vertebral artery, suboccipital nerve, suboccipital venous plexus, posterior auricular nerve. Question number 10th. Please mark the right answer. So, I am getting a right answer. Posterior auricular nerve, absolutely correct. Yes, posterior auricular nerve is not a content of suboccipital triangle. The content of suboccipital triangle is suboccipital nerve, which is dorsal ramus of C1, first cervical, suboccipital venous plexus, and also third part of vertebral artery. Absolutely correct. So yes, you can see here the boundaries and you can clearly see the boundaries, and this is the boundary, this is the boundaries which I am highlighting it. Inferiorly it is bounded by obliquus capitis inferior, suprolaterally by the obliquus capitis superior, and rectus capitis posterior major. So inferiorly by obliquus capitis inferior, okay, and here will be rectus capitis posterior major, supromedially, laterally is obliquus capitis superior, and content is suboccipital nerve, vertebral artery and suboccipital venous plexus. So yes, my dear aspirant, before ending, all of you can join me on the Unacademy platform for the free session of the series of the 100 MCQs. So we have to complete up to 75 number MCQs. So my dear aspirant, this is more of clinical MCQ, mixed person, but most of the questions will be clinical MCQs. All of you do join live for the session. This will be highly beneficial for you. The students who have not downloaded the Unacademy app, they should download it. Use my code NAT10 and be present live for the session. This will be highly beneficial. Okay, my dear aspirants, I would also like to tell NEET PG free test calendars, and till 12th March the has been shown to you the test. Enroll in free test by using the code NAT10. And I would like to gladly tell you about the Unacademy store opens on 13th March, and be the first to join there. Have the registration done, and you have to fill the registration form. And my dear aspirants, you have the opportunity to meet the no, it's not completed. It will take today and one more day. I will take Monday also the continuation of the session. Okay, so no, it's not complete. Now you can join me on the Unacademy special free platform for the another 15 MCQs. This is the Pusa Road, Old Rajendra Nagar, Delhi. Do visit Unacademy store, highly beneficial. You have got the opportunity to meet your favorite educators, and this is the pricing detail of Unacademy Plus and the Iconic. Decide which subscription you have to take. Use my code NAT10 to get an extra discount of 10%. Thank you, all the best, keep studying. We will again meet after 15 minutes. After 15 minutes, we can meet in the special class free platform. Do join live, all of you. It is highly beneficial. More of clinical MCQs. Thank you, all the best. Do like, subscribe the Unacademy Let's Crack NEET PG platform. All the best, keep studying. Thank you so much.